The visit by the Director General of the World Health Organization to Goma was brief but necessary. Health workers responding to an Ebola outbreak in parts of the region were attacked last week by Mai Mai rebels in an area where people are still being infected by the disease. 4 died, and in this hospital the WHO chief visits those who were injured.
Even one Ebola case could spark a fire. So the same thing now, actually, with a major one, with a major security incident like this one, our concern is even more. So it may take us longer than it would have taken with the progress that we had.
Everything you have in green.
Here the agency's Ebola emergency coordinator shows us what they're dealing with. The red spots you see are the focus points. It's in mining villages in Biakato, about 70 kilometers from Beni town, where most of the new cases are being detected. Yet it's one of the most unsafe areas and where the health workers were recently killed.
To end the outbreak, it's important to stop all transmission in Biakato. And it's very difficult to access because it's a forest area, around the mining areas. So making sure that we have full access to Biakato and all the villages and mines around Biakato is important to end the outbreak.
Up to a dozen Ebola responders have been killed and several treatment facilities attacked since the outbreak started nearly a year and a half ago. WHO has killed down operations in Beni because of the current security crisis. This affects people tracking the disease. We met Asimwe Bakitwika in Beni 3 weeks ago. She's among volunteers who monitor people who've been in contact with Ebola patients. Health officials tell us one of the biggest concerns is how people like Asimwe can safely keep in touch with those they monitor for Ebola symptoms.
We are doing contact tracing, but if you look at over the last week, the performance went down because we were around 90% performance. Last week, it drops, up to 59%. And this is a major problem because we want to make sure that all high-risk contacts are followed up and detected early enough.
In Goma, the WHO chief also met with those tasked with containing the disease, some of whom have been evacuated from the Ebola front lines in Beni because of the uncertain security situation. Health workers hope to reduce the number of Ebola cases to 0 by the end of the year, but they also say this is going to be hard if the security situation in Beni is not resolved quickly. Catherine Soy, Al Jazeera, Goma.